Hello, my dear student. Today we are going to explain and discuss the topic of patient classification system, prepared by Sarah Sabri, Assistant Lecturer in Nursing Administration Department, Faculty of Nursing at Cairo University. This content is prepared for Nursing Administration Clinical students 2020 and 2021. The objectives: at the end of the session, the student will be able to define a patient classification system, explain the purposes of patient classification system, enumerate the importance of patient classification system, explain the patient classification formula, and will be able to calculate the nursing care hours and number of nurses needed per day or per month. Just for remember, we have to remember the nursing administration process. It consists of 5 processes, started from planning, organizing, staffing, directing, controlling. Our topic today would be included at the staffing process, the third process, which is called staffing. Patient classification is one step, or considered to be a one step involved at the staffing process. And now we are going to define the patient classification. We are focuses on patient needs through grouping the patient according to their needs and the degree of their dependency on nurses. Now we are going to speak about the purposes of patient classification. Number 1, it will help you to categorize the patient according to their needs and time and the skill needed to satisfy each category need. Number 2, determine required nursing hour needed to provide safe care based on the standard of care to satisfy the patient need. Number 3, determine a number and category of staff mix, which means skills of nurses needed to satisfy the patient's need. At number 4, determine a workload and the nursing care requirement through our nursing assignment. It will help in making the nursing assignment. And now we are going to explain the importance of patient classification system. As we know, the purpose is to categorize the patients regarding their needs, and so it will help and improve the patient satisfaction by providing required time to the patients according to their needs. It will guarantee quality of patient nursing care and also enhance the staff satisfaction by determining the staff needs, which would decrease the workload. And now, to calculate the nursing care hours and determine the nurses needed per month or per day, first we have to use the patient classification sheet. This sheet, we would apply it at the clinical setting. And now we are going to take an overview on this sheet and a hypothetical situation how to apply it. The patient classification sheet consisted of 8 items, starting from eating, grooming, toileting, comfort, general health, treatment, medication, teaching, and emotional support. Each one of these have 4 categories, and we will have overview on it later on. And now we are going to take an example for application. Our example at critical care unit, number of beds 15 bed, number of patients 10 patients, shift option 12 hours. Our hospital, there is some hospital take shift option 12 hours, long shift and night shift, and other hospital take the 3 shift option shift اللي هو as morning or after or night. The actual working days per month 17 shift. There are some hospitals take 13 shift or 15 shift. And now we are going to calculate the number of nursing care hour needed and the number of nurses needed per day or per month. And this is the patient classification system sheet. Through the sheet, we are going to categorize the patients. As we know, we have 10 patients. we will make this sheet for each patient individually. And started with the patient name, department, average of working hours of nurses, diagnosis, date, shift, total number of patients, as we know 10 patients, average of working days per nurses per week or per month. This sheet categorizes the patient from category 1 to category 4 regarding the 8 item as we discussed before. Category 1 started from the completely self-independent patients. Category 4 refer to the self-dependent and complete dependent patient. And now we are going to look for the patient at the eating item. Score or category 1, feed self. Category 2, need some help just in preparing the food tray. Category 3, need some help and facilitation, but still able to chew and swallow. Category 4, as we know, and as we said before, completely dependent on nurse, such as take his feeding through right. And so on for the other item, just like grooming, self-sufficient, able to wear clothes. And the category 2, the most obvious word at the category 2, need help. The patient at category 2 need help. Patient at category 3 need help and some facilitation. Category 4, as we explained before, completely dependent on the nurse. And so on for the other, toileting, comfort, general health. Also at the treatment, medication, teaching, and emotional support. As we hypothetically choose a patient and give him a score at category 1, take score 1, at the medication take score 2, the teaching and the emotional support take score of at category 2. And then we calculate this all scores, it will be a score 14. Now we have to figure what the meaning of the 14, our score of 14, it will be the patient will be at category 2. Look carefully to this table. This is the category of the patients from category 1, category 2, category 3, category 4. At the assessment sheet you have done before, you will take or make the score of 14. This score 14 filled at the category 2. This category 2 reflect the nursing care hour needed for this patient per 24 hour at all day. It would equal 6.2. And you have to know this table carefully. As we know, and we classified the patient regarding 4 categories, started from 1, 2, 3, 4. And each category have nursing care hour. Category 1 started from 4.8, category 2, 6.2, category 3, 8.2, category 5, 10.8. And now we are going to start with the first equation, started by total nursing care hour per day. As we have been taken at our hypothetical situation, we hypothesized that we have 10 patients in our critical care unit. Through performing the patient classification sheet, we hypothesized that we have 2 patients at category 1, 5 patients at category 2, 2 patients at category 3, 1 patient at category 4. And we will multiply the number of the patient to the nursing care hour needed through each category. It would equal category 1, 2 by 4.8 equal 9.6 hours per day. Category 2 equal 5 by 6.2 equal 31 hours per day. Category 3, 2 by 8.2 equal 16.4 hours per day. Category 4, 1 by 10.8 equal 10.2 hours per day. The total nursing care hour per day equal the total number of the nursing care added to each other. 9.6 added to 31 added to 16.4 added to 10.2, it would equal 67 hours per day. The second equation, average of nursing care hour per day equal total nursing care hours divided to total number of patients. It would equal 67 divided to 10 equal 6.7 nursing care hour per day. Equation number 3, number of nurses needed per day equal average of nursing care by number of beds divided to shift option equal 6.7 by 15 divided to 12 equal 8.37 nurses per day. Equation number 4, number of nurses needed per month equal number of nurses per day by 13 divided to actual working days per month equal 8.37 by 13 divided to 17 equal 14.77 nurse per month. This is the only equation we would take the round up of the number and would equal 15 nurse per month. And now we are going to conclude the formula needed to calculate the patient classification system, which is consisted of 4 equations. Equation number 1, total nursing care hour per day. Equation number 2, average of nursing care hour per day equal total nursing care hours divided to total number of patients. Equation number 3, number of nurses needed per day equal average of nursing care by number of beds divided to shift option. And finally, equation number 4, number of nurses needed per month equal number of nurses per day by 13 divided to actual working days per month. And now thank you for the attentive listening and good luck.